Okay. Is that? Uh-oh.
There it is.
Does that work for everybody?
Mm-hmm.
Mm-hmm.
All right. Well, T, I guess we should probably get started.
Yeah, we're a couple minutes after. All right, welcome to the Rooted Clinical Wellness webinar for December. Just as a reminder, we do the first Thursday of every single month. We do a webinar. This month's webinar, Understanding Your Gut Health, Your Body's Hidden Ecosystem. Discover how the microorganisms living in your gut influence your overall health, from digestion to immunity and beyond. If you'll jump to the next slide.
Well, there we go.
All right, meet your practitioner, my lovely wife, Jennifer Hoskins. Has been a nurse for over 20, won't say 25 years, over 20 years. We'll keep it at that. She's worked in the hospital in cardiac care, worked as a school nurse. She's worked in urgent care, primary care, and women's health. So she has the whole diversity of every health system and function you can imagine. And then has become a nurse practitioner, has been practicing in all those spaces as a practitioner as well, and recently has moved into functional medicine. So with that introduction, I'll turn it over to Jennifer.
Thanks. So, not sure why each of you may have signed up for this. If you were just curious, or you're symptomatic, or you know somebody who might be. So, today's webinar is kind of wordy. I just apologize on the front end. There's a lot to gut health. It's not very simple, and we are only going to scratch the surface. So as I go through, if you have questions, if you could save those to the end, just so that we can get through it. And if there's anything that really appeals to you as far as like, hey, I need to check that out, we will talk about that at the end as well. Okay. So this first slide here about what is gut health and why does it matter? When we say gut health, we're talking about the entire digestive system, especially the intestines and what's living in there. Your gut is home to trillions of microorganisms, which is just crazy to think about. It's been compared to like a garden, and you have to have the right conditions, the right soil, and all of the right things to make that thrive. Of course, the microbes, they help to digest food, extract the nutrients from the food. They produce our vitamins, support our immune function, and then just keep the gut lining strong. So it's not just about avoiding stomach problems and digestive issues. It's foundational for how our whole body functions. So what the gut microbiome actually does, it helps break down complex foods that you couldn't digest without it, especially fiber. You can't digest that without the help of the bacteria. They create short chain fatty acids. There we go. Short chain fatty acids, and those work to reduce inflammation, support our metabolism, and keep that gut lining strong. Like I said before, they also help make vitamins, some of the B vitamins and vitamin K. And our gut helps metabolize medications as well. So sometimes two people take the same medicine and it affects them differently. And it's actually because of the way that their gut is breaking it down. And approximately 70 to 80% of our immune system is located in our gut. So it's a big deal. And if our gut health is not good, we'll find ourselves getting sicker more frequently. So this is just, again, talking about how it affects our whole body, that it's more than just digestion. We talked about how much of the immune system is located there. It also affects our brain function, our mood, and of course our metabolism too. And that is not just the microbiome. It's obviously, there's a connection with nerves and hormones as well. And we know that there is a direct communication between the gut and the brain, and it's called the gut-brain axis. If you've not heard this term before, it is like the two-way communication system that connects the brain and the gut through nerves and chemical signals. And through this, we can experience, if there are problems with an unhealthy gut, we can experience mood swings, brain fog, depression, anxiety, and it can affect our stress tolerance, our sleep, and overall cognitive function. And the research connecting gut dysfunction to chronic disease is especially like the inflammatory conditions, metabolic issues like diabetes, autoimmune disorders. That research just keeps growing. So common disruptors of gut health. You're probably going to relate to a lot of these, but I would say the number one for most people is our diet. We are doing it to ourselves, especially when we are consuming diets that are low in fiber and high in sugar and processed foods. We're not giving that good foundation for our gut bacteria to thrive. And so for a lot of people, and we'll talk about steps we can take, but cleaning up our diet is a huge part of having a healthy gut microbiome. Medications. So we see clear effects to our gut with medications. Of course, you've probably all heard that antibiotics can kill the good bacteria in your gut. So we know antibiotics affect our gut health significantly, but also other medications that you may not realize are affecting your gut. A couple of them are pretty common ones. Proton pump inhibitors, also called PPIs. You might know them as omeprazole or Prilosec is the brand name. You're taking those to decrease acid, but unfortunately, when you're reducing the stomach acid, you're actually allowing the oral bacteria to colonize. And the stomach acid, which is supposed to be killing that bad bacteria, doesn't. So now you have a unbalanced, too much bad bacteria compared to the good. Certain antidepressants like SSRIs, they can alter the bacteria's composition and the function, and then that will in turn affect the intestinal motility. So the movement in your gut is affected by that drug as well. Metformin. A lot of people take metformin. It's common for type 2 diabetes, typically the first drug that most people are put on when they are diagnosed. That is actually associated with an increase in E. coli, which is we all have a certain amount of E. coli in our gut and several other bacteria. But when that gets overgrown, it can lead to problems. And we do see that with patients on metformin. Statins as well. That's cholesterol lowering medicine. A lot of people on statins. They are shown to alter the composition, and it reduces beneficial bacteria. This one study actually said specifically that it is reducing the beneficial bacteria Akkermansia. So again, we're taking them for a good reason, but it can have some unwanted side effects, and most of us don't know that. And I can tell you, in my years in primary care, this was not part of my education with my patients when we were putting them on metformin and antidepressants. That's not part of the education. Of course, it is with antibiotics, but and then another common one that a lot of people take, and an occasional use, not so bad, but frequent use of NSAIDs, and that's going to be ibuprofen, Motrin, Aleve, all those brand names. That can irritate the gut lining, and then that in turn disrupts the balance of the good bacteria as well. And then this other one here on lifestyle factors, we can all probably relate with that. So when we're getting poor sleep, having high amounts of stress, or not very much physical activity, that can alter our gut composition as well. It increases inflammation, and it's going to disrupt that communication between the gut and the brain. Specifically with poor sleep, there's several studies out, but just a couple of highlights from some of the ones that connect sleep and gut health. Talks about how poor sleep can lead to increased cravings for high fat and high sugar foods. I'm sure we can all attest to that. Also, lack of sleep can reduce the function of the gut's protective barrier, so the lining, and potentially increase our risk of leaky gut and inflammation. And also, not getting enough sleep is going to weaken our immune system, which of course is linked with gut health as well. And then when we talk about chronic stress, stress is going to disrupt the communication pathway between the brain and the gut. And then people have seen, there's actually some research that shows when that is interrupted, we have increased symptoms like bloating, pain, and irregular bowel movements. That stress can also lead to changes in the types of bacteria and then the balance of it as well. And then, of course, for people who have GI conditions like IBS or IBD, stress typically worsens those symptoms as well. And then lack of physical activity. We know that sedentary lifestyle is associated with lower levels of beneficial bacteria altogether. But it's interesting to read too that athletes actually have a more diverse and robust gut microbiome. That those are in quotes from a study compared to sedentary individuals. So just understanding how exercise can help reduce inflammation and oxidation and actually improve the makeup of our gut health. And then, of course, environmental toxins in that last box there. Those can be, just toxins in the environment, pesticides, household chemicals, that can all affect our gut function. And there is so much information out right now about that. I'm just going to hit on a couple. I'm sure most people are familiar with BPA. It's the I don't actually know how to say it. So BPA found in plastics. It's been linked to altered bacteria composition, inflammation, and metabolic disturbances, and actually is a factor in obesity and liver disease as well. Pesticides, we have probably all heard of glyphosate, which is the chemical in Roundup that actually depletes the beneficial bacteria, leads to the gut inflammation, and obviously the gut barrier is affected by that too. There's some others with some household chemicals. There's one called triclosan. I don't know if I'm saying that right, but it was an antimicrobial additive, used to be in body wash, things like that. 2016 FDA banned it, but it is still in hand sanitizers. It's in detergents and soaps that may be in our house. And that can cause inflammation of our colon and exacerbate colitis if somebody has, inflammatory bowel disease. And of course, it affects the microbiome as well. So all of that to say, most people dealing with gut issues don't just have one disruptor. It's usually a combination of those things that can really damage our gut over time. All right. So what does poor gut health look like as far as symptoms? Those symptoms are going to be different for everybody. They're going to show up differently. Some people are going to struggle with constipation, while others have diarrhea and bloating. A recent large study showed that irregular bowel habits can let's try that again, guys. A recent large study showed that irregular bowel habits can signal deeper metabolic and inflammatory risks. And there are lots of studies. That's not just from one. And then we're going to see symptoms that are more than just digestive issues. We're going to see fatigue, mood changes, anxiety, depression, trouble sleeping. And we'll touch on the trouble sleeping here in just a minute too. And of course, when the gut lining is irritated, food sensitivities increase. So, it may be that you were able to eat things for years that suddenly you cannot tolerate anymore. And some people even go on to develop an allergy towards them. And again, if we can really improve our gut microbiome, a lot of those food sensitivities will decrease. And then, just whenever we have an imbalance in the gut, we can have high levels of inflammation, which is going to lead to long-term chronic disease. So they don't always look like just gut problems. It can show up in several areas of the body. So this was the one I was mentioning on sleep. So this was actually, there's quite a bit of studies done on this, but this was on a newer study that had come out, and I wanted to share a little bit of information on it. So this one looked at more than 400,000 people, and it found that there were strong links between gut bacteria and insomnia. And some of the bacteria themselves, like the types of the bacteria, actually increase the insomnia risk, but then others were protective. So it broke it down into exactly what strains of bacteria were good versus ones that were going to lead you to more insomnia risk. And of course, this study, we can't say cause and effect, but it does show that there is a clear connection there. And, overall, what we see is that when patients are able to improve their gut health, they sleep better. So if insomnia is an issue for you, that may be related to your gut. So some more research that I find fascinating. Not sure if you do, but the connections between our hormones and the gut. So again, I already mentioned metabolism, mentioned inflammatory, issues, metabolic issues like diabetes, that sort of thing. And of course, that's related to hormones. But there's quite a bit of information that as our hormones shift, so as we're aging, us ladies getting closer to menopause or already in it, obviously our estrogen is decreasing, and the same for men. As they're getting older, their testosterone levels are naturally decreasing. And as those decrease, the gut, it will notice changes, right? It does affect our gut. And so both of those hormones, whether we're talking estrogen or testosterone, they regulate motility in the gut. So when those levels drop, our digestion naturally slows down. You're going to see more issues with constipation, bloating, and gas. In those times when you have a decrease in those hormones. They can also increase gut inflammation. And so, again, you can have abdominal discomfort, indigestion, or just that your digestion feels off, even though, you haven't really changed your eating habits. And then the beneficial bacteria, as those hormones decline, the beneficial bacteria decrease, and more of the inflammatory microbes can rise. And so it can just be unbalanced in what we call dysbiosis. So the bad bacteria is getting higher than the good bacteria, and of course it can cause issues like SIBO, which is small intestinal bacterial overgrowth. When that microbiome is off, you can have a yeast overgrowth, things like that. And of course, bottom line, it's going to affect how you digest food and how much nutrients you can absorb. And then we talked a little bit about our stomach lining barrier and leaky gut. And estrogen is known for helping to maintain just a good, healthy gut lining. And so as that decreases, you are going to be more at risk for leaky gut. Or what we call intestinal hyperpermeability. Basically, what's happening there is that particles that should not be getting out of the gut are able to get out. Our gut has a real tight junctions in the lining. And as that permeability increases, those junctions open up, particles come through that should not. And so you can develop leaky gut symptoms. And those symptoms are when we talk about like potentially having more food allergies. There's a clear link between leaky gut and autoimmune conditions. So again, what started as just what seems kind of like a small problem with barrier integrity can lead to a whole lot of other issues. So again, during these times of, especially in menopause, as estrogen is dropping, women oftentimes have digestive issues, and supporting that, which is another conversation we'll have about estrogen replacement. But that can be a really good answer for women who are dealing with these issues. But we'll cover that in another webinar soon. All right. So we talked about all the things that could go wrong, a very, high level of just what could be going wrong. But what we probably all want to know is, how can we keep those things from happening? How can we support a healthy gut? And really, it's going to be lifestyle issues and making sure that we are, first of all, focusing on diet. I mean, that's for most people would be the biggest issue. And so when we talk about diet, we want to make sure that we're eating a fiber-rich whole food diet. And that is the number one way to support our microbiome. Drinking water, so staying very hydrated, matters to several systems, but definitely keeps your digestion moving and also helps to protect that gut lining. With the movement, the physical movement that we're doing, we're also helping with gut motility and just increasing that diversity. Remember when I mentioned that athletes have much more microbial diversity than people who are sedentary. So just the activity alone can help increase that good bacteria. Of course, managing stress is huge because, that physical stress is definitely going to change the gut environment. And then even simple habits like better sleep and rest to reduce gut inflammation. And if you know me or know how I have set up my practice, it's really important to me to always address all of the pillars. There's 4 pillars that I talk about. We talk about physical health, we talk about mental health, emotional health, and spiritual health. And so when we talk about rest, you know, I don't know how familiar you are with Exodus 20, but that's where God commands us to take a Sabbath. And this is not just because it's one of his rules, it's for our good. And so that rest and really making sure that we are taking care of ourselves and having a day of rest, or at least having a few hours of rest, can do wonders for inflammation. And then again, these are a lot of things we don't have to get it perfect, but if we can at least be pretty consistent in really watching our diet, making sure we're drinking, we're moving, and we're resting and controlling our stress, people can see huge changes in their gut health.
Jen, can I add a couple to that previous slide?
Yes.
Yeah, something I thought of was the fact that we talked about the environmental factors, and one of those things that I thought about that we did a while back was, you know, getting rid of the Tupperware. We talked about the plastic. You microwave food in plastic, and that plastic leaches into the food. So we switched to all glass containers, and then obviously buying as much organic food as you can to get away from the glyphosate or the Roundup is another good one. So just a couple things to think about.
Yeah, there's, you know, it's good you bring that up, Tim. I hadn't put that in here, and it can feel overwhelming sometimes when you think I've got to overhaul my whole kitchen, right? Got to get rid of the plastic, got to get rid of the Teflon and coating, and got to eat organic and all of those things. But little steps, and again, like, we don't have to be perfect, but little steps moving in that direction can really, really make a big difference.
Yeah, I mean, we did that over time, right? We just bought one stainless steel pan, one cast iron pan. You know, it doesn't have to all happen at once. So
yeah, and learning how to cook in a stainless steel pan is very different than a nonstick. Just FYI.
I highly recommend YouTube videos. Yeah.
Excuse me. All right. So when we talk specifically about food that helps, excuse me. Tried to swallow wrong. So whole food diet. So obviously no processed foods. If it has a label or a barcode, it's probably not something you want to eat a lot of. I know convenience is a thing, but the more whole foods that we can eat, the more we're going to benefit our gut. And so I just kind of broke it down into some sections here. So high fiber foods, and I listed some there, but the fiber feeds the microbes. So they have to have a way to reproduce, and the fiber is what they're eating. And so if you could kind of think of it like fertilizer, you know, if we go back to that garden example again. And so I've listed some of the foods there, whole grains, vegetables, beans, things like that, that are fiber. And there actually are, as much as I say, we don't want to have a lot of processed foods, you know, in a pinch, if you are trying to get, you know, your protein in and you're eating protein bars, things like that, some of them actually have a whole lot of added fiber. And so if you are choosing things like that, go for those options that have extra fiber in it, because most people do not get enough fiber. That next one, fermented foods. So fermented foods can be really helpful. They are just one small piece. And I'll say that with a little bit of caution. If you have some obvious digestive issues, if you're bloating, gas, that sort of thing, it may not be the time to add in the fermented foods. That can be very individualized, of like who benefits from that when. Now, eventually, when we get your gut health good, those fermented foods are great. We're talking things like yogurt and kefir, kombucha, even, you know, pickled vegetables and sauerkraut, and my favorite, sourdough. I make a lot of sourdough bread. Those can all be good. But like I said, if you are in the middle of that bloating, gas, discomfort, adding those foods is probably only going to increase that. So we would have to treat that first before we reintroduce those. Also, the processed foods, we talked about that already, obviously, just trying to avoid that, because processed foods, it's hard to know even what's in it, but we do know that people who are on, you know, consume a decent amount of highly processed foods have a significant amount of inflammation in their gut and throughout their body. And then, like I said, the personalized approach, really, just to make sure, again, if you have bloating, gas, stomach upset issues, you may have a bacterial overgrowth, or maybe you have a yeast overgrowth. And so we don't always add in those prebiotic fermented foods right at the beginning. But, plan to add them back because they are part of a well-balanced diet for your gut. So that's a lot of words, a lot of information. Hopefully you learned a few things, but, I would guess that some of the symptoms we talked about today are probably familiar for you, whether it's digestive issues or insomnia, fatigue, mood swings, or if you found any of those medications that I listed, ones that you're taking and you're wondering if that is playing a part in your gut health and maybe need to investigate that a little bit more. If you're curious about your symptoms, there are several tests that we do, some blood tests that we do, some advanced testing, stool testing, that sort of thing, where we can really look at your gut health. And that's part of what I do. In fact, that's a big part of what I do with my patients at Rooted and taking a functional medicine approach. And so it's not something you have to figure out on your own. I know we get bombarded with, gut cleanses and this probiotic and that probiotic. It can be overwhelming for all of the things that we're hearing about gut health. So the approach that I take is certainly not a one size fits all. We do testing. We see what you have. Do you have an overgrowth of bacteria? Do you have a yeast problem? Do you have the good bacteria? Are your what we call the commensals, are those all in line and how they should be? And so then when we do talk about supplementing, we supplement what you need versus just a broad, everybody gets the same, treatment sort of thing. So Tim is going to tell you a little bit more on this next slide. We do have a December special we're offering that I will let him tell you more about.
Yeah. Before I dive into that, the other thing you mentioned, the testing discovers what your current gut biome is like, right? And you have yeast overgrowth, bacterial overgrowth. But the other one is parasites. That's one that we also end up finding folks that have one or multitude of different parasites. So.
And for some reason that freaks people out. It is so common, especially we don't test for it in the US. In other countries, they test for it all the time, but yeah, it's pretty common.
All right. So typically with any visit with Jennifer, whether you're just exploring, whether you're diving into a program, we always start with a no charge consultation. So it's just a 30-minute call where you can kind of talk about what's going on with you as a patient. So whether you're watching this live right now, a few of you that are here, or you're watching the recording, you have the ability to scan that QR code. That'll take you directly to our booking site, and you'll have some options, different days, times, later evening appointments that you can select from. So feel free, if you just want to explore more with Jennifer and do a quick 30-minute, no cost consult, you can scan the QR code to do that. Our special for December, just as folks are thinking about kicking off the new year, focused on their health and those types of things, we are offering for anyone that enrolls in either a 3-month or 5-month program. And Jen typically will guide you to the right program based on that 30-minute consultation, right? So, Jen deals with all sorts of conditions that run the spectrum. So for managing hormone health, it might be a 5-month program because you're going to tweak different things, supplements, etc. Maybe you're even doing replacement therapy or something like that. Over time, you're going to have to track, what those changes are. So that's a longer program. With gut health, maybe it's a shorter program. It just depends on what's going on. ADHD in children might be a longer program to manage. So she'll kind of fit you into the right one based on what's going on. But if you do sign up before the end of the year for a 3 or 5-month program, we are offering a free 30-minute lab review, what we call lab launch. So we can take existing results, as long as they're within the last 18 months, that you might have labs from your regular doctor. Jen can look at those and kind of kick off your program by doing a review of those. And it's a quick way to automatically start diving into maybe some potential changes. Keeping in mind that with functional medicine, when Jen reviews labs, we don't just generically say, I'll take testosterone as an example. If your testosterone is over 300 and under 1200, you're fine, right? And that's not optimal, right? So optimal is probably somewhere between 700 and 1000, right? And so every single lab has this generic range in the medical world that's just a male between the age of 25 and 35, and we're going to poll millions of men in that range, and then that's comes up with the generic range of okay. Definitely not optimal though, and that goes for everything from hormones to magnesium and calcium and every single thing you intake, which all again ties back to gut health. So you get that 30-minute lab review for free, and then along with that is a complimentary advanced lab add-on. So an advanced lab, as an example, would be what we call like a GI map. A GI map is checking all those different parameters around gut health. It's quite exhaustive stool test that we do. That test by itself is what we call an advanced lab. It's fairly expensive. It's like a $300 test. So that's included for anybody who's interested in booking a program. I think I covered everything, didn't I?
I think you did.
Right.
Yep.
So,
well, and I would just say too, if you feel like you would like to share this with anybody else who might have symptoms that you're thinking about, please do. They'll get the special as well, as long as they book. They don't have to start the program before January, but as long as they book it before January, then they can get those discounts. Or not discounts, I'm sorry, add-ons.
And for our live audience, if anybody has any questions, feel free to unmute and chime in or chat any questions anybody has. Nobody has questions. All right. Well, thank you everyone for attending. We'll send out the recording, and if you want to follow up, feel free. You can hit us up at the website or email, which is listed there on this page, or scan the QR code. Have a good one.
Thank you all. Appreciate it.
Thank you. Great info.
Yeah. Thanks.
Yeah, lots of it. It's great. Thank you.
Bye-bye.
Bye-bye.
Bye.